Hey, future medics, Tina here, your medic mentor. And today we're going over medication that EMS doesn't give anymore, but you are going to see when you're treating cardiac patients, especially the older populations. It's digitalis, but more often you'll hear it by its generic name, digoxin. This one falls under a cardiac glycoside, and it's used to treat a flutter, atrial fibrillation, and sometimes heart failure. But how it works is pretty specific. It increases the strength of the contraction of the cardiac muscle, so positive inotropy, while reducing the amount of conduction through the AV node, thus slowing the heart rate, negative chronotropy. All of that to say, it's a much stronger squeeze at a lower and controlled rate. Here's the thing though, digoxin has a very small therapeutic window, meaning that too much of it gets toxic very quickly. That's why we don't see it used very much anymore, but you will still run into it out there. Signs of digoxin toxicity are a lot like the symptoms it was trying to treat, so it can make this one really hard to spot. Have a high index of suspicion with your older population who's still in charge of taking their own medications. Somebody else doesn't give them to them, but they do it because they may have forgotten they already took it for the day and take another one, which is incredibly dangerous. Signs of digoxin toxicity include confusion, nausea, vomiting, bradycardia, PVCs, yellow-green halos around your field of vision, other arrhythmias. So it's not great. In EMS, we don't give this, but you are still going to see patients who are on it, and it's going to be important that you recognize an overdose on this one. That's why we're still teaching it in paramedic programs today. Now, the dose on this one is a little different than you've seen. It's got a loading dose and a maintenance dose. The loading dose is 0.25 to zero point 0.5 milligrams, and then the maintenance dose is going to be 0.125 to 0.25 milligrams every 2 to 6 hours. You're going to give that IV or IO. Just a heads up on this one, calcium can make this much worse. So we're going to do our best to get a med list whenever we can. Take a look at it, see if digitalis or digoxin are on there, and watch that monitor like a hawk, and you'll be fine. All right, that's another one knocked out. You're doing such a good job. I'll see you soon for the next one.